Hello everybody. Today I'm going to discuss about the topic how the field of psychiatry came into existence. We're going to learn about the history or the evolution of mental health services and treatment. So how this field of psychiatry came into existence. Okay, how was the ancient beliefs of people or the attitude have been changed as the years have passed, right? So, the historical development of psychiatry. The origins of the most of the psychiatric concepts begin with the prehistoric times when the primitive people believed that the spirits possessed the body and had to be driven out to effect a cure. So earlier, what people used to believe, our ancestors, they used to believe that a mental illness is not actually a problem with the brain. They believe that it is because of some evil spirits or demons that were in the person, okay, which made them to behave in this abnormal way. So the only way that they had was to drive out this demon from a person by using some methods, or you can say some actions, like they used to torture the client, beat them up, they used to amputate them, or they used to burn them alive. So all such practices that they used to follow just to make the body an unsuitable place for the demons to live in. So because what they believed is because that the individual were not following the cultural norms or the rituals of the particular society or the culture, they were behaving in an abnormal way, and the only way that they thought is because of the evil spirits which was there in him, and the only way out for the cure was to take out the evil spirit or the demon out of the body of a person so that he will become normal. So that was the ancient, or we can say the practices which was done by our ancestors, which was a very cruel act to the individuals, right? So yeah, before the 5th century BC, the Greeks, Romans and Arabs believed that the emotional disorders were an organic dysfunction of brain. So even though these practices were done, but in the 5th century okay, BC, there are some group of people like Greeks, Romans, and Arabs who believed that a person behaved in an abnormal way because of the dysfunction of the brain. So we have each the contribution of the different. Our ancestors, or we can say the great personalities towards the mental health, right? So we're going to see each one of it in detail, right? First person we have Pythagoras. Okay, he is the one who gave us the concept of that the brain is a seat of intellectual activity. So it is the very important part in the human body which has the function of intellectual function, right? So Pythagoras was a person who gave us the concept that brain is the one which is called as the seat of intellectual activity. Then we have Hippocrates. He described a variety of personalities or temperaments and proposed that mental illness was a disturbance of. So Hippocrates, he explained that mental illness was due to some changes in the body fluids. So the 4 fluids in our body are going to make the changes, or because of these changes in these fluids, okay, there were the different personalities or different temperaments in the individual. So that is the reason what the Hippocrates gave. Then we have Aristotle. He concluded that the mind was associated with heart. A person who told that there is a connection between the mind and the heart. It means to say maybe about the feelings or the emotions, right? So Galen, a Greek physician, stated that emotional or mental disorders were associated with the brain. So we have this person Galen who told that mental disorders are the ones which are due to the dysfunctions in the brain, or the which is associated with the disorders of the brain. So emotion, we can say emotions and the mental disorders were the ones which are associated with the brain. There's nothing to do with the other parts of the body or the fluids or anything. Then we have got acidiasis, we have got Asclepiades. Yeah, we have got Asclepiades, who is called the father of psychiatry, who has given the new approaches to the treatment of the mental disorders. So he told that the treatment approaches for a mentally ill individual is nothing but good nutrition, good physical hygiene, music, and recreational activities such as riding, walking, and listening to the sounds of waterfall. Asclepiades gave for treating the client with the mental disorders. He also emphasized that the environment around the individual plays a very important role for the good mental health, like fresh air, sunshine, and pure water, which will help in the promotion of the mental health, and it will heal the mental illness. Right. So we have got, this was the historical period how the different people contributed to the field of psychiatry. Then we move on to the Middle Ages, to the year 1773. So we have this people who suffered a lot and who has mentally ill individuals, and they were excluded from the society, and they were confined in asylums or institutions. So earlier, mental hospitals were called as asylums. So mental patients or the mentally ill person was called as a lunatic, and the hospitals where the people were kept, okay, it was called as asylum. So a mentally ill individual suffered a lot, and they were put in asylums. Even the conditions in the asylums, if you can see, it was very kind of dull. Maybe there was no sunshine there, and no, like a dark room, isolating the patients, chaining the patients, and hitting, beating the patients. So all such cruelties were happening to the mentally ill clients. So during the age of Middle Ages, so various theories pertaining to the demonic possession was also advanced during that period. They specifically believed that the people are behaving in such a manner because of a demon in them, and they were isolated in such asylums, and they were subjected to such kind of cruel actions. People who displayed abnormal behavior were considered as lunatics, witches, or demons possessed by the evil spirit. So they had a superstitious belief, or they believed that people are behaving in this abnormal way because of some witchcrafts, or there are some magical powers which has made a person to behave in this way, or an evil spirit has entered in a person. That is why he or she is behaving in that abnormal way. So superstitions, magic, and witchcraft prevailed as patients were locked in the asylums, flogged, starved, tortured, or subjected to bloodletting. So these were cruel actions which were done for the patients. They were starved, not given food, they were beaten up, they were tortured physically, and they were kept in the asylums, changed. Beheading, hanging, and burning at the stake were the common occurrences. So they were burnt alive, they were hanged, and also they were tortured physically in various ways. So this was the cruelties which was happening during the period. And during the same time, there were other group of people who believed that mental disorders is not because of the evil spirit or because of any demonic possession, but there are some changes which happens in the brain of a person. That is why a person is behaving in this way. There were some group of people who believed that this is the exact reason. So during the same time, physicians described symptoms of depression, paranoia, delusions, hysteria, and nightmares, who were got an awareness about the disorders, they started grouping the disorders into different categories like depression, paranoia, delusions, hysteria, and the nightmares. People displaying such symptoms were taught to be incompetent and potentially dangerous. So, people, in a sense, the individual who had these kind of a disorders, they were termed to be very dangerous, and they were termed to be incompetent in various ways. So these were the beliefs of the people. So later they have analyzed that the mental disorders, or the person is behaving in an abnormal way because of the dysfunctions of the brain, right? So they said the first mental hospital was the Bethlehem Royal Hospital, which was opened in England in the year 1403. In the year 1773, the first mental hospital in Virginia, US was established. In the year 1793, we have this person, Philip Pennell, who did a first revolution in psychiatry. The first revolution which happened in the field of psychiatry is removing the chains from a mentally ill person. Philip Pennell is a person who had removed the chains from the mentally ill clients, because earlier people with mental illness, they were chained, they were isolated. So this person who had done a very drastic change, or can say the revolution in the field of psychiatry, which is removing the chains from a mentally ill client. That is the first revolution in the field of psychiatry, which was done by the person Philip Pennell. And 1812. So in the year 1812, we have the father of American psychiatry, who is the Benjamin Rush. So Benjamin Rush, the father of American psychiatry, he has written the textbook of psychiatry. He was the person who wrote a textbook on psychiatry. In the year 1908, Clifford Beer, The Mind That Found Itself, is a book that changed the conditions of mental hospitals. So this person, Clifford Beer, is also a very important personality, you can say. So he himself was a mentally ill individual who suffered from delusions and paranoia. So he who stayed in the mental hospital, he was sent to mental hospitals, and he wrote the autobiography about the life in the mental hospital, how the people or the mentally ill individuals were being treated in the mental hospital, was what were the conditions, how the people or the staffs behaved towards the mentally ill client. So this is he is the person who has written his experiences, or we can say autobiography, in his own book, okay, which is called as The Mind That Found Itself, which changed the condition of the mental hospital. So later on, after reading his book, okay, after listening to his autobiography, his experience being as a mental patient and staying in our mental hospitals, the world has changed the conditions which were there in the mental hospitals. The new approach was done. Okay, the new approach was given to the delivery of the care. In the year 1912, we have the person Eugene Bleuler. Okay, so he is a Swiss psychiatrist who coined the term as schizophrenia. So he was a person, Eugene Bleuler, who had given the new term called as schizophrenia for the disorders wherein there were a lot of delusions and hallucinations. So he was the person who coined the term schizophrenia in the year 1912. So in the year 1938, ECT was used. So in the year 1938, there was the treatment option for the mentally ill clients, especially in terms of people with severe mania or severe depression. So people who suffered from that, the new treatment option which was used was the ECT, electroconvulsive therapy. Then in the year 1939, Sigmund Freud, so he is the father of the psychoanalytical theory, he gave us the concept of various developmental stages, or what are the changes which happens in the various developmental changes, the psychosexual theory, and also he gave us the therapy called a psychoanalytical therapy. So, who has contributed much to the field of psychotherapy. So, in the year 1949, the drug called as lithium was used for mania. So, people started using this drug lithium carbonate for the treatment of mania or manic excitement. And in the year 1952, chlorpromazine, the drug chlorpromazine made a revolution in the field of psychopharmacology. So the drug chlorpromazine was introduced in the year 1952, wherein these right now, we are using these medications for treatment with these as antipsychotic agents. So that was the era which happened from Middle Ages to the year 1773. Now we'll move on to the psychiatric nursing history from the year 1773 to 1956. So what were the evolutions or the changes which happened? So the 18th century is regarded as the era of reason and observation. So many people contributed to the field of psychiatry. They observed why the people behaved in an abnormal way. They reasoned out. They gave the rationales as to why the people were behaving in this abnormal way. They tried to understand, and they got a new knowledge that people had some disorders related to the mind. That is why the people are behaving in such a way. According to Peplow, 1956, the historical development of psychiatric nursing began in 1773 when we have this revolution which happened in the field of psychiatric nursing. So Peplow is called as the mother of psychiatric nursing. So Hildegard Peplow, she is called the mother of psychiatric nursing. So we'll see the development of psychiatric nursing in various phases. We have from phase 1 to phase 5. So each of it we are going to see. So first phase 1, this the emergence of psychiatric nursing from the year 1773 to 1881. So how the field of psychiatric nursing came into existence, right? Special institutions for individuals with psychiatric disorders were built, and we have a person called as Benjamin Rush who wrote the first American textbook on the psychiatry, and attendants were hired to socialize with the patient. So since the patients were treated in a different way, you can say they were isolated, they were not given a chance to interact with the society just because they behaved in an abnormal way. So what happened in this particular period was they appointed or they hired various attendants who could spend some time with such kind of the patients, so that the patients will develop the socialization. So attendants were hired so that it will help for the patients to get socialized, right? Then we have Philip Pinnell, who classified the clients according to their observable behavior. So based on the behavior of the client, whatever they exhibited, this person, Philip Pinnell, he was the person who classified the mental disorders according to the behaviors what was observed, right? So next we have the schools of nursing, which was established in Boston and Philadelphia by 1872. By the year 1872, the schools of nursing were established in Boston and Philadelphia. Dorothea Linda Dix devoted time to improving conditions of mentally ill persons. So we have the Lady Dorothea Linda, who has contributed a lot of her time was spent with the mentally ill patients for improving their conditions. So that happened in the phase 1. So moving on to the phase 2, there is a development of work role of psychiatric nurse. So what is the work responsibility of the psychiatric nurse? That was developed in the phase 2. So from the year 1882 to 1914, so the changes which happened in terms of the work responsibilities, right? Training schools for nurses in the psychiatric setting were established at McLean Hospital in Belmont, Massachusetts, and at Buffalo State Hospital in New York in the year 1882. Trained nurses were employed in the state mental health hospitals in the year 1890. So we have a special training for psychiatric nursing. So such trained nurses were employed in the state mental health hospitals. Yeah. The next thing which happened is the first undergraduate psychiatric nursing program was established. So the first UG program in the field of psychiatry was established. National Society for Mental Hygiene was founded in the year 1909. Large state mental hospitals were built even in the rural areas. So they had concentrated, it's not only the urban community who is suffering from the mental disorders, but even the rural areas which requires the mental hospitals. So large state mental hospitals were also set up in the rural areas. So moving on to the phase 3, what are the changes, developmental changes? So development of undergraduate psychiatric nursing education. So here we have the development of the psychiatric nursing education from the year 1915 to the year 1935. The changes which happened. Linda Richards, the first graduate nurse in the United States, suggested that mentally ill clients receive the same quality care as physically ill clients. Yes, so we had the first nurse who is the Linda Richards. So she, when she was working with the patients, she identified that there were a lot of discriminations which was done, with the physically ill clients and mentally ill clients. So she contributed her point saying that even the mentally ill individuals require the same treatment of what is being delivered to a physically ill clients. So Harriet Bailey wrote the first psychiatric nursing textbook, which is called as Nursing Mental Disorders. So this is the first person who wrote the textbook in the psychiatric nursing, okay, who is Harriet Bailey, and the name of the book is Nursing Mental Diseases. So next thing is John Hopkins, the first school of nursing, had fully developed in psychiatric nursing course. So the psychiatric nursing course was, included in the curriculum of this particular school, which is which was set up by John Hopkins. Insulin shock therapy, the electroconvulsive therapy, and prefrontal lobotomy were introduced in the psychiatric clinical setting. So as a treatment option in the third phase of development, there were options like not only the ECT, the electroconvulsive therapy, but also the insulin shock therapy, the prefrontal lobotomy. Okay, all these options were introduced for treating the psychiatric conditions. So that is happened in the phase 3. Moving on to the phase 4, so what were the changes? Development of graduate psychiatric nursing education. The development of graduate psychiatric nursing education 1936 to 1945. So approximately half of the nursing schools provided psychiatric nursing courses. So we know in the phase 3 itself, the nursing courses were started in various hospitals. So now the more emphasis was done, most half of the nursing schools, okay, if you take the percentage, half of the nursing schools had this program or a course in psychiatric nursing. That's a graduate program. The National League of Nursing Education developed curriculum guidelines for nursing, psychiatric nursing graduate education. So the National League of the Nursing Education, they developed a curriculum or a syllabus for a psychiatric nursing education. By the year 1943, 3 universities sponsored graduate programs. 3 universities who sponsored the graduate programs for psychiatric nursing by the year of 1943. So moving on to the phase 5. So what are the changes, developments happened in phase 5? Development of consultation and research in psychiatric nursing practice. So we have got the development of the research in psychiatric nursing, 1946 to 1956. So 1952, Hildegard Peplow contributed a theory which is called as interpersonal relations in nursing, interpersonal relationship theory, which was developed by Hildegard Peplow in the year 1952, which concentrated on how to maintain or how to develop the interpersonal relationship, how to develop the interpersonal communication, therapeutic communication, interpersonal relationship with the clients when we are delivering the care for the mentally ill person. 1953, Maxwell Jones, who concentrated on therapeutic community, the environment or the community which has to be given to the person who is mentally ill, right? The environment should be therapeutic for the patient to overcome the problem. So that is what the milieu, we concentrated on the milieu of the client. Yes, so these were the contributions which happened in the psychiatric nursing. So what are the mental health services in India? So what are those mental health services in India? During the British era, the Indian mental health was a child which was born to the British parents, but it was bred in the Indian culture. The Indian Lunacy Act of 1912 was based on the British legislation then in force. So whatever the laws or the acts which was developed in India, the basic thing was the mother of these acts were taken from the British, right? So it was based on the British legislation. The Indian Lunacy Act of 1912 was based on the British legislation. Right. So before the British rule, what was the thing which happened? During the reigns of King Ashoka, many hospitals were established for the mentally ill person. A temple of Tirumukkadil, Chingalpat district, Tamil Nadu, contains inscription on the walls belonging to Chola period. So you can see in the image, these were the inscriptions which were done on the wall, which happened in the Chola period. The inscription mentioned what this inscriptions or the writings on the walls depicted. Yes, a hospital and a school. The hospital was named as Sri Veera Choleshwara Hospital and contained 15 beds. The first Indian mental asylums, that is Mandu Hospital, opened in Muhammad Khilji 1436-1969 at Dhar, MP. First lunatic asylums, Bombay Asylum, was built in modern India in approximately 1750 AD at the cost of 125 rupees. No traces of it is present today. So even though the traces are not present today, the first mental asylums was built in the city of Bombay in the year of 1750, which was built for an amount of 125 rupees. In the year 1794, a private lunatic asylum was opened at Kilpok, Madras. So this was the thing which happened at private hospitals in Madras. The Central Mental Hospital, Yerwada, Pune, was established in the year 1889. First asylum for insane soldiers was started at Mulger, PR in the year 1795. The British established this hospital on 17th May 1918 with the name of Ranchi European Lunatic Asylum. It had a capacity of 174 patients, that includes 92 males and 82 females. Later, the Hospital for Mental Diseases and Central Institute of Psychiatry, which is there in Ranchi, for European patients and was staffed by British Army doctors. So the Central Institute of Psychiatry, Ranchi, the year previously it was staffed by the British Army doctors. The history of institute dates back to 1847 when Bangalore Lunatic Asylum was founded. In the year 1925, the government of Mysore rechristened the asylum in the name of the mental hospital. The Mysore government mental hospital became the first institute in India for postgraduate training in psychiatry. So the Mysore Institute was the first institute which had offered the postgraduate degree for nursing in the field of psychiatry. All India Institute of Mental Health in the year 1954. NIMANS was established in the year 1974. The first Indian psychiatrist to be recognized by the Royal College of Psychiatrists is Professor Narendra Brigg. And the Board Committee report was submitted in the year 1946. So moving on to the independent India, mental hospitals were established at 5 places in India. It is established. So we have it in the Amritsar 1947, Hyderabad 1953, Srinagar 1958, Jamnagar 1960, Delhi 1996. 1954, Noor Manzil Mental Health Center started orientation courses in psychiatric nursing. We have in the year 1956 1-year diploma in psychiatric nursing at Nimans. So we have diploma in psychiatric nursing course which was started in the Nimans in the year 1956. In the year 1963, Community Mental Health Center Act was passed. 1986, INC included psychiatric nursing in the GNM syllabus, and in the 1987 there was a revision of the Indian Lunacy Act of 1912 as the Indian Mental Health Act. So these were the revision which happened, which we got a new act called as the Indian Mental Health Act. It replaced the Indian Lunacy Act of 1912. So these were the changes which happened in the India. Right. So moving on to the mental health services as on today in India, what are those services which is given? First thing is the institutionalization versus the deinstitutionalization. So earlier, people used to send the patients, okay, if they had a patient with mental disorders, they were sent to the mental hospitals and they were allowed to, they made sure the patient, even though he is cured or there is a development or improvement in the client, they didn't want the person back to their home or to their community, fearing the stigma of the society. So that was the thing which people used to put the patients in the mental hospitals, in the certain institutions where they were left there to be taken care of. But now, nowadays there is a change, that there is a new revolution of deinstitutionalization. So even though there are patients with mental disorders who can be managed at home, who can be given certain opportunities or independent activities or occupations which can be carried out to certain level. So they are placed at various institutions, they are placed at families, they are placed in education institution or the hospitals to take care, or they are placed in various companies, we can say, or rehabilitation programs that we can say. So that was a change which happened from being abandoned in the institution of mental hospitals. They were, nowadays they are given a chance to work in various areas or various field, even though there is a limitation to some extent, and they are, it's not mandatory if a person is considered to be mentally ill that he has to stay in the mental hospital for treatment. No. When he becomes better, he can be shifted back to the families, he can be shifted back to the community, wherein people are aware that they can lead a normal life to some extent. So these are the changes which has happened from institutionalization to the deinstitutionalization. Focus is shifted to the community-based care. So nowadays, the focus is on the community-based care. So people go to the community area, identify the people with the mental disorders or people who require the treatment. So they will be referred to the mental hospitals for the treatment, and once they are, feeling better, they can be put back to the community. They can be replaced to their family. Okay. We have a lot of many social workers who will collaborate that particular work. Okay, so the community based care can also be delivered to the client in terms of the treatment part, or in terms of various therapies, or in terms of delivering the care to the patients. Right, district mental health program is also started, wherein in the particular program various district, okay, we have the district hospitals where they go and they will do the delivering these services in the district level, at the district level. National mental health policy is established, and revision of the Mental Health Act is done, wherein there is a improvement in the rights of the where there are improvements which is made for the mentally ill clients in terms of their rights, in terms of their legalities, and also the some of the new privileges which a mentally ill clients can get out of it. So these are the changes which has happened. Where we can see a new India, which is emphasizing the need of delivering the mental health services to the people and the community. Hope you have all understood the topic. Thank you so much.